historically we would call this class of drugs painkillers. We can't often eliminate the pain. The goal is to make it manageable. I've always really believed in a really holistic approach. Once they do come off some of these medications, they actually feel so much more clarity and better than they had anticipated.
Welcome to the Habit of Possibility podcast, the show about turning obstacles into opportunities. I'm your host, Robbie Spier Miller. Today, we're talking about new, more personalized ways to manage chronic pain with pharmacist Stacey D'Angelo. She shares how your DNA, mindset, and medication history all play a role in pain, and how tools like pharmacogenomics and hypnosis can help people find relief without relying solely on medication.
Hello, everybody. This is Robbie Spier Miller, your host for the Habit of Possibility podcast. And today we're welcoming Stacey D'Angelo, who is a pharmacist, and she specializes in something called deprescribing, which I had never heard of before I met Stacey. My understanding is what it is that she'll look at the situation you're in with your medication and help you sort out what is actually working for you or not working for you in drug interactions, or helping you get off certain medications if it's appropriate, and all the interactions between the drugs. So I'm going to have her explain that to you a little more. She's joining us in the big picture because we want to explore the topic of pain management and what can drugs do for us for pain management, and what are some natural alternatives such as hypnosis, which we help people with hypnosis for pain management. So I would love to hear, Stacey, your experiences helping people with that, because I know it's a very complex and difficult situation that a lot of people find themselves in. So go ahead and introduce yourself. Tell us a little more about what you do, and then we'll dive in.
Absolutely. So first of all, thank you so much, Robbie, for having me here today. I was really excited when you offered to have me join you on the podcast for two reasons. One, obviously, as you mentioned, I'm a pharmacist, and I do specialize in this area of deprescribing, which is really helping people to come off medications which are no longer right for them. And as well as pharmacogenomics, which I'll kind of explain a little bit in a second. But as it pertains to deprescribing, this can often happen in the area of pain management when it comes to medications for pain. So especially if we're dealing with chronic pain, medications may need to be changed over time. And if you're dealing with chronic pain over the course of a lifetime, your body changes and your medication regimen may need to change over time as well. And it's not always that simple as just stopping the medication. So that kind of comes into play there. The pharmacogenomics piece is another area that I help to specialize people optimize their medication regimens by understanding how their DNA, their genetics, influences their response to medication. So we can actually proactively understand which medications you're more likely to have side effects to, which ones are more likely to work for you or not, which can be really useful in pain management, as well as has a big role to play in the area of mental health, which those two areas often kind of interplay with each other. So I think that's my kind of professional hat. I'm really excited to be here for that. I also come with my own kind of story of experiencing chronic pain myself. I've had back pain for about 15 years now, since I was in my early 20s. So I have had my own journey kind of with the area of kind of chronic pain management and realizing what works and what doesn't work in terms of not just medications, but from a holistic perspective. So I'm happy to share anything around that kind of story as well. So yeah, it's an honor to be here with you.
Yeah, great. And I think it's amazing that with what you do, there's less trial and error, because often you hear people trying a medication and then it doesn't work and they have to try another one. And there's this whole long period of experimentation. So it's amazing that you're able to predict some of the effects that's going to help people.
Absolutely. I think that's the goal, to have a little bit more of a proactive approach and preventative approach. Even if we can just, reduce that trial and error. I always tell people it's not necessarily going to be like a silver bullet, but it will kind of give us a little bit more kind of pieces to the puzzle to have better chances of getting it right and avoiding what's wrong for you.
Yeah. All right. And these days there are lots of choices for something like pain management. I know, my mom used to take these shots. She had very severe arthritis and spinal stenosis in her back. And so she used to go for these regular injections to help with the pain, and then at some point they weren't working anymore. She was having side effects. She couldn't get them anymore. And so I saw her go through that whole process. And some things worked for her and some things didn't. And in the end, she just had to mostly live with the pain, which is pretty brutal. Like it's exhausting and makes it difficult to enjoy everyday life. So I know a lot of people are struggling.
Absolutely. I think even just kind of historically, we would call this class of drugs painkillers, right? But this is actually a misnomer, because in most cases, especially except for in very acute situations, we can't often eliminate the pain. We're just kind of, the goal is to make it manageable, or to be able to increase your function and to really kind of live alongside the pain and not in the pain. So yeah, that comes a lot into play. One of the areas that we've chatted about before, and that I also believe really strongly in, is your mindset around medications also comes into play, very much so with pain. And I think even at what I see in practice is how people feel around their medications can often impact how, not only how they work for them, but how they use the medication. So I'll see two ends of the spectrum. Some people who hate taking pills and never want to take pills, and sometimes they're avoiding the safer option, which maybe you use more frequently to get that pain under control because they don't want to take pills, but it results in the pain kind of skyrocketing to a point that is like unmanageable, and having to use options which are not as safe or more risky or have more side effects long term. So that's just one example of how that might come into play. But I think it's not as simple as many other areas of medicine where it's like cardiology, you're going to take this pill and it's going to reduce your cholesterol levels and that's it. Pain is quite complex.
Yeah, for sure. From a hypnosis point of view, when we experience pain, it sends a signal to our mind, and then our subconscious mind interprets that signal and sends another signal back to our body. So the mechanism of using hypnosis for pain management is to shift the perception we have of that signal, so that the signal that gets sent back helps us be more comfortable and helps us, relax, because stress adds to pain. And then sometimes there are emotional things around the pain. Like sometimes, if people are suffering more, they get more attention from their family, for example. And if they feel better, they're not getting that attention. So, or they need to go back to work, or, right? So sometimes, and sometimes it's accidental, like people have no idea they're doing it, but there are these emotional components as well. So, from the point of view of what we do here, a lot of the work with pain management is helping people learn how to have more choices around that. So I'm curious about how did the drugs impact people, or when people get the injections or the other options, how that may have an impact.
So a couple of things kind of came to mind as you were kind of telling about that. First is, even back in pharmacy school, day one, we always learned pain is people's perception of it. It's not something you can test in a lab. You have to really rely on that individual in front of you, and just it just speaks to not only the physical element of the pain, but the connection with those kind of brain wirings. And I think I can totally see how hypnosis would have a big impact. The other thing we know is that, like, the pain and the biopsychosocial factors, right? It's the biological impacts of the pain itself. So why are you experiencing the pain? Is it an injury or a trauma or a disease process, or all of these physical factors, the biological factors, but it's also those psychological factors. And we all know, for example, if you're tired and stressed and you experience chronic pain, like I know myself, if I'm stressed, I know that my pain is going to flare up. And so just kind of thinking about that in your everyday life, it's clear how those are interconnected. And then the social impacts as well, right? The cultural factors. And, we know if people have a lower education or income level, they're more likely to experience pain, and vice versa. So I think all of those factors just show how interconnected all of this is, and complex, in how really, I think most people who experience chronic pain, in order to get it well managed, or managed to a level that's good enough for them or better for them, have to tap into all of these elements to kind of be able to have that kind of level of comfort or level of, function in their life.
If you're enjoying this podcast, please like and follow us and post a review so other people can find us too.
Can you tell us maybe an example of somebody you've worked with who needed this kind of help with deprescribing and how you navigated that whole thing, just so we can
for sure
wrap our minds around how it works?
So I guess an example around some medications that might be used for pain management. So I think when we think about pain management, we often think about these injections or anti-inflammatories or opioids. A lot of times we'll also see things used off-label for pain, like anticonvulsants or seizure medications. Something like gabapentin or Lyrica is very commonly used for pain management, especially for what's called neuropathic type of pain. So that stinging, burning sensation. For example, if you've had shingles in the past, a lot of times antidepressants can be used off-label for these kind of indications, things like Cymbalta or tricyclic antidepressants. And especially those medications can be really difficult to just stop. And they do have, maybe not immediately, but long-term, more risks and side effects. So as we age, especially with normal physiologic changes, like changes in your kidney function and, an increased risk as we age to our brain function and cognition, many doctors will start talking to patients about tapering off these medications for pain. And at a certain point, we don't know, if you've been on it for a long time, is it still helping you? I mean, we don't really know until we try and kind of pull back a little bit. So those are kind of some of the situations that I'm really helping patients with to kind of taper off slowly, in also talking about this holistic perspective. What else can you be doing in addition to the medication to set you up for success in kind of pulling back on this medication? And just kind of seeing what's the best scenario for you as well.
All right. It doesn't happen that our bodies adapt to it. So if we're taking a certain dose of pain medication, that dose won't work anymore, and we need to even higher dose to get the same effect. Does that happen?
Absolutely. So not with every single medication. Some classes of medications more than others, but things like opioids, things like benzodiazepines, things like gabapentin, those things over time, your body becomes tolerant. So it's not working as well as it did in the past, which means either you need a higher dose. Sometimes you kind of max out on the dose. So you might get to a point where it's really not going to be beneficial to keep going up. And so unfortunately, I definitely see patients who kind of are in that situation where they need to start pulling back. And it can be difficult. It's easier if you do it with support and slowly with someone who kind of specializes in that area, and also working in conjunction on these other strategies that can help you manage the pain in other ways. So it can be done. I think there's a lot of fear for patients around that, especially if they've been on it for a while, but it absolutely can be done. And I hear from patients that once they do come off some of these medications, they actually feel so much more clarity and just better than they had anticipated.
Yeah, and I can totally see it, because if a medication has helped you and you perceive it as you need it to function, it must be very stressful to consider weaning off of it or trying something else, because who knows? It's what you know. So
exactly.
Often our tendency is to stick with what we know, even though it's not working, because it's familiar and we believe it's safe for us.
Absolutely, especially if they've had a bad experience. So maybe they've missed a day of their medication, or missed a dose, or they've tried to reduce in the past, but they did too big of a drop. So they went from 100 milligrams to 50 milligrams. That doesn't mean that it's not still possible and not still beneficial. Maybe if they went down by 10 milligrams, or like as an example, did it a bit differently. But those experiences can really bring up a lot of fear and anxiety around the process, even if they might be better off without it.
And do you do this in conjunction with their doctor, or how does that work?
Yeah, so always what I'm doing, especially working as a pharmacist and working as kind of a consulting pharmacist, I work for the individual, not really like a health team. So I'm always working with them and their doctor or their prescribers. Sometimes they might have multiple prescribers. So basically I work with them to kind of understand their history and what they want to achieve and their kind of health goals, kind of review the medical kind of aspect, and then write a consultation note and work in collaboration with their prescriber and with their kind of care team to ensure that there's that continuity there as well.
And something that I could see is amazing about this is you have one person looking at the overall picture, because sometimes if you have a lot of health conditions and you're seeing a lot of different doctors, they're not paying attention to what each other's doing, or they're just looking at their specialty.
Yes.
They're not looking at, they might be interacting and they might not even see the interaction.
Absolutely. I definitely see that. And especially sometimes they don't want to step on each other's toes, to be quite frank. There might be something that was prescribed 5-10 years ago that's still there. And I'm kind of like, is this guidelines, say 1 year, for example, but the other doctor doesn't want to step on the toes. But when there is independent third party kind of overview of everything from a drug expert and collaboration with the person who wants to feel healthier and is on board with the change, we get a lot of good traction.
Yeah, and let's face it, in the healthcare system, doctors are overworked. They don't have time or not necessarily the expertise to really see the whole picture. So it's really great to have this available.
Yeah, absolutely. There's definitely the systemic factors today. It's just a reality of our healthcare system, and we're very blessed in Canada to have this amazing acute care system, but definitely sometimes on the chronic disease side and on the preventative side, I think there's definitely some gaps to fill for sure.
Okay. So if people who are listening are interested in accessing this type of support, what are some typical scenarios where people come to you, or what are the best, maybe moments or situations where you can help people the most?
Yeah, I would say kind of 3 areas. One is someone who knows they want to come off a medication but are struggling. So someone can be, I talk about deprescribing. A lot of the research for deprescribing actually happens on people who are on many medications. So often the geriatric population who's on 10, 15 plus medications. And definitely, like I was saying, there's a great opportunity for those individuals. I'm often working with sandwich generation people caring for their elderly parents or aging parents, to just kind of give that independent third-party advice and overview for them on where they might be able to pull back and kind of on certain medications. So that's kind of one element. I also think there's opportunity for people who are even on one medication that's difficult to stop to get that support that they need to do it safely. So these are medications like sleeping pills, anxiety medications, antidepressants, various medications kind of in that realm that really can cause withdrawal effects, and it's not because you're addicted to the medication, it's really a physiologic dependence on the medication over time. And so doing it more slowly and with support, we're just starting to get research into this area. So that's kind of an area that I really focus on and work a lot with clients around.
Yeah, because a lot of serious addiction starts by somebody taking medication for a real reason.
Absolutely.
And then they
medications.
just don't know how to focus on what's next in a useful way. Yeah.
But deprescribing support, all of the clients that I work with are not at the addiction population. Addiction occurs when that surpasses the point to where you're taking the medication and it's causing harm. You're taking more than is benefiting you. You can be taking the appropriate dose, have no issues, but also it's not benefiting you anymore, or you're at that tolerance point, or you're concerned about, or a great example is anxiety medications. Maybe you were prescribed these at a point where you had a job loss or lost a loved one. You've done all the work, you've put in therapy, you've done all these things to 2 years down the road. Do I still need this medication anymore? I think I might be ready to try and come off it. but you have trouble doing it at that time, because if you try and cut it in half, you're starting to get brain zaps and headaches and agitation and all of these things that aren't addiction, but it's a difficult scenario to be in. So that's kind of the place that I can provide some support.
Yeah, it's interesting you say that, because working as a hypnotist over the years, I work with thousands of people, and it's pretty common that somebody has been on something like an anti-anxiety or antidepressant medication for decades.
Yeah.
And when you ask them about it, and I'm not a doctor, so I can't have any opinion, but I get curious about, what prompted them being on this medication, just so I know some background. And often there is some kind of life event.
Yes.
But yet the life event is like way over and they're still on the medication. I wonder if they're afraid to get off of it because they don't want to go back to how it was before they were on it. But the whole thing that prompted the situation isn't true anymore.
Yeah.
So, yeah.
Absolutely. This happens every single day. And I think a big part of our community, like, they're quite common these days.
Yeah.
And you don't realize these kind of subtle differences that you might be experiencing, but you're kind of used to. Like, the big kind of couple things with antidepressants specifically, sometimes for anxiety or mood, is like what they call emotional numbing. So you may not experience the low lows, but you also may not be experiencing the high highs and the happiness and joy or pleasure in life that you could be experiencing. And sexual dysfunction is another really common kind of side effect of these medications. That's not something that you just happens when you start the medication. It can be lifelong. It can obviously impact your relationships, which also impacts your mood. And so it's quite cyclical. And if you really take some time to think about it, I think a lot of people could be more in a position to kind of think about, doesn't have to be necessarily stopping, but pulling back to see how things go.
And as they're looking at that, if they're building some better ways of coping with life, then the same life events might not have as big an impact on them as they used to.
Absolutely. I mean, that's the goal. That's the goal.
Yeah. And so I think it's really wonderful for people to discover that they can handle it. A lot of people are worried that they're too weak or they can't function.
Yeah.
And so they're relying on the meds and I know some people need them, and if they need them, it's great that we have them.
Absolutely.
But I think that, if they can have the kind of support you're providing and safely come off of them and develop other ways to be more resilient and flexible and help themselves, that's, I think it's really great for their confidence and for their life, because they're actually functioning better instead of just numbing out.
Exactly. Just living a more kind of full life. I think for me, the biggest thing is to just get out there in the awareness that these withdrawal symptoms can occur. I think a lot of people might try to stop or, miss the dose or cut it in half or something like that. And, experience anxiety or agitation or headaches and just automatically think, oh, it's because I still need the medication, not realizing that it's actually not a return of the thing, but it's due to that stopping too fast. And that is the piece that we're just starting to learn more from the scientific community perspective about why people are experiencing these things and how prevalent it really is and how impactful on life. And I would imagine that a lot of people, try and they think they still need it, so they stay on.
And I think there's something to be said for believing it's worth it and having some idea of what the road ahead is like, so there's a realistic expectation.
Yeah.
I think that can help a lot of people, because then they just know, oh, okay, this is going to be, and I don't know what the time frame is, a few days or a couple weeks or whatever, but then life is better.
Yeah.
So believing that can...
Absolutely. And honestly, there's such a huge variation of people's experiences around coming off certain medications. It depends on the medication, like the physiology of it, how it works in your body, how long it lasts, in terms of how long it might take. But I also see a huge variation in how slow people need to taper. Some people very slow, some people can tolerate going more quickly. And so that's why I think that individualized approach, it's not that easy to get a prescription that says decrease 25% every 2 weeks and you're done, because I see the difference in how people respond to that. And some people need to go slower. I guess just that awareness that is the case.
Yeah, then they need the support. So it's great that you're there. I know when my mom was really ill, she was prescribed a medication, and so she took a dose and she had a really bad reaction. But it was hard to know, was it from this actual medication or was it a coincidence? And then she just didn't take it and she couldn't get in touch with the doctor. Like it took him like 2 weeks to get back to her.
Wow.
Yeah.
That's awful.
And it was, a serious situation. And so it's, I think that that's not an unusual experience that people have. And it's not the doctor's fault. They probably just have way too much to do.
Yeah.
So it makes people make decisions that are very short-sighted and not necessarily in their best interests. Yeah,
absolutely. I'm sorry that your mom went through that, and I'm sure you, as well as the caregiver, like not enough has been said with the caregiving, situation. I think that puts a lot of strain on people as well.
Yeah, and also that you're in charge of making the decisions. Like I was the power of attorney for her health. And so with that responsibility, you don't have enough information to make a good decision. So it's complex for sure.
It is.
Yeah. And so when you're working with people, do you suggest some like natural alternatives or what kind of things do you offer?
Yeah, absolutely. I've always really just in my core believed in a really holistic approach. I used to, prior to this, had a clinic where I had worked with naturopathic medicine and holistic nutrition and all of this. And I just learned from my own personal journey how important that is. So I am definitely a believer in, incorporating multiple modalities. I think whatever is the right roadmap for you is very individual. For some people, it's supplementation, depending on your lab work. For some people, it's nutrition. For some people, it's physical, modalities like chiropractic or acupuncture or physical exercise, physio. For some people, it's mindset, meditation, hypnosis. In reality, and for some people, it's medication. And in reality, most people need pieces of all of those, and your individual kind of treatment plan that's going to work best for you is like very unique. So I think my goal is really to just work with people to explore where they're at in that process, what they know works for them, what they want to explore, make suggestions where I can, but just be very open to like their own desires and that type of thing.
Yeah, that's great. And it's interesting from my point of view because physical and emotional pain actually are registered the same way. And sometimes we cause emotional pain for ourselves that's not even existing in reality. And so learning how to manage that better, right? Because it's like we do help with physical pain management with a note from the doctor, but we also help a lot of people learn how to interact better with life so that they can feel better in the first place and look at things in a way that is more useful for them. Because, our subconscious mind's job is to protect us from danger. So if we have a way of coping that looks like it protected us and we're still here and we feel okay or we've adapted to the situation, we'll tend to hold on to it. And the truth is often there are better options out there. And so we're really helping people discover what other options they have from a functioning in life point of view and an emotional point of view or a relational point of view.
That's so interesting. I love to hear how that kind of tapping into your subconscious, like what you don't even realize your patterns are, and then being able to shift them through hypnosis, I feel would be a really great complement to managing chronic pain, but also just becoming more healthier and vibrant in so many areas of life. It's really awesome.
For sure. Yeah. And just as an example, years ago, I had a client who was coming for weight loss when we got a doctor's note because she was extremely overweight. So it was considered a medical situation. So with the permission of her doctor, we did some hypnosis, and her story was that she had lost a child when the child was really young. And maybe like 4 years old. I think that the child died of cancer, which is totally heartbreaking. And it must have been an awful experience for her to go through. And then she proceeded to gain well over 100 pounds. And she never even saw that she was eating to numb the pain.
Mm-hmm.
And it was decades later, and after gaining all that weight, that she started to see that and be able to have choices around that. And then, the people around her were supportive of her, emotionally, but accepting how she was treating herself, because nobody wanted to rock the boat, or, she'd been through enough, which is the truth.
Yeah.
But that, to have that moment of realizing, oh, maybe I can be safe enough now to discover some other ways that I don't need to rely, self-medicating with food is something a lot of people do. And to discover that that's not necessary, and that there are choices, can be a really powerful thing. And that's just one example. But as you talk about, we're looking at the whole picture. When we see that, it's easier for an outside person sometimes to see where the person who's struggling could make a powerful change. So,
wow, that's incredible. Definitely, it starts with that connection and awareness. If that piece is not there, how do you make the choice?
Right.
So unveiling that whole connection, I think, is really powerful. And being able to navigate the waters to what's next. Oh, that's really powerful.
And there's an adjustment time, because when people have those discoveries, it's like the whole world rotates on its axis, because they've been living a certain way for so long. So having that feedback along the way and learning the skills to handle this new life, it's like entering a whole new way of looking at life. Having that support can be really helpful for people. So we do a lot of that kind of thing in various circumstances with people, so that they can make their life better than they imagined it could be.
Wow, that's really powerful. It's really cool.
Yeah. So it looks like we have lots of opportunities to collaborate, Stacey.
For sure.
Yeah, great. Is there anything else you want to share with the audience?
No, I don't think so. I think, just being able to share and talk to you more about pain management, about medication, about deprescribing. I think bringing awareness to this topic that I'm really passionate about. My own journey with pain is that, for me, it's been such a multimodal approach. I have to be keeping the stress down. I have to be exercising. I have to be taking the right supplements, and, using pain management appropriately to keep it at bay. It's not ever going to go away. And I've had to come to terms with that, and also shape my own understanding and beliefs and mindset around that as well. And that's okay. And that's finally got me to a place which is manageable and better. But it's been a great opportunity to share that with you and to learn more about hypnosis. I think it has a huge role to play in not only pain management, like you said, but so many factors as it relates to health. So.
For sure. Yeah. So tell us how people can get in touch with you if they're looking for help.
Yeah, absolutely. So you can find me at my website, which is simplehealthpharmacist.com, or online on LinkedIn, Stacey D'Angelo, or Instagram, Your Simple Health.
Great. Yeah. All right. Well, thank you so much.
Thank you for having me. It's my pleasure.
Thanks for listening. You can learn more about Stacey's work at simplehealthpharmacist.com or on Instagram at Your Simple Health. And if you're curious about how hypnosis can support pain relief or medication changes, visit hypnosistrainingcanada.com. If this episode helped you, please share it or leave a review to help others find it too.